We all noticed at the Grammys how beautiful everyone looked, and this year was a little bit different because people's eyes looked more awake, vibrant, and radiant. So in this video, let's talk about some of the eye work that the celebrities are getting done under or over the radar. We're going to talk about some of the eye work that some of the celebrities are having with really minute but impactful changes that make their eyes look more awake, radiant, and vibrant. This could be canthopexy, upper eyelid blepharoplasty, or even non-surgical interventions to treat hooded eyes. By the way, guys, I didn't get to the nail salon this week because it's been crazy busy in the office, so just don't mind my nails and hopefully this doesn't scare anyone. So what are hooded eyes versus non-hooded eyes? Hooded eyes is when you have excess upper eyelid skin that kind of hangs over the eyes. It can make our eyes look smaller or more tired, or they can actually rest on the lash line that gets in the way when we're trying to do our eyeshadow or wing our eyeliner or do our makeup. So if you find yourself doing this when you're applying your eyeliner or eyeshadow, then likely you have hooded eyes, or what we call in dermatology, dermatochalasis. How do you know if you have hooded eyes? And the test that we usually do in clinic is if you pinch your upper eyelid skin and you close your eyes and your eye can close all the way even with your eyelid skin pinched, then usually you're a candidate for upper eyelid blepharoplasty or a non-surgical upper eyelid tightening procedure. And if your eyelid skin stays tented up once you let go and your eye is at rest, then you know that you have excess upper eyelid skin or hooded eyes. If you're feeling like you're tired at the end of the day, or if you look tired, it's likely because your eyes are straining and your frontalis muscle in your forehead is working extra hard to keep your eyelids open. So people that have hooded eyes feel like they look and feel tired at the end of the day when you've been raising your eyebrows to kind of overcompensate for the fact that you have heaviness in your upper eyelids. Non-hooded eyes are eyes that don't have excess upper eyelid skin, that look awake and more round or almond shaped, that don't look tired. They look awake and rejuvenated, and you don't have to pull up on the eyelid when you're putting on your makeup. Why would people want to fix hooded eyes? Because it's a really usually minor change that we can make that has profound impacts on the way we look and feel. Especially if we're busy or feeling overtired, it will help make you look and feel rejuvenated, especially at the end of the day. Also, it can bring your eye shape back to what it once was, or if anatomically you never really had bigger eyes, it will give you an opportunity to open up the eyes and just show off your beautiful eyes and look more well rested and healthy. Some people can have anatomically or genetic hooded eyes, and some people can not have hooded eyes when they're younger, but gradually progress to have them as they get older and they gain wisdom and have birthdays. So sometimes people who have genetically hooded eyes will see it worsen as they get older. And regardless of the cause, there's different ways that you can help rejuvenate and correct hooded eyes. Sometimes you'll hear the referred term monolid, and monolid is not exactly hooded eyes. It's a genetic variant where the anatomy of the orbital rim and the periorbital tissue is a little bit different, and it has to do with muscle insertion sites and a variation of anatomy in the eye. So just to delineate the two, a monolid is not necessarily a hooded eye. A hooded eye is usually something that can be present early in your age because of an anatomical variant, but is usually something that gets worse as you get older and the eyelid skin gets thinner and the collagen thins out and becomes less structural supportive of the upper eyelid as you get older. How to get rid of hooded eyes. There's different ways to treat hooded eyes, and you can go non-surgical or a surgical route, and there's different options in which we'll discuss in this video. So a few of the options that we're going to talk about are for surgical intervention and upper eyelid blepharoplasty. For people who don't want surgery or want a non-surgical option, we can talk about thermage for hooded eyes, thread lift for hooded eyes, or neuromodulator or Botox for hooded eyes. I'm also going to tell you what my favorite option is for hooded eye treatment. My favorite treatment option for hooded eyes is thermage. Thermage is an energy-based device that uses heat in the form of radio frequency to stimulate collagen and to help tighten eyelid skin. There has to be a specific eyelid handpiece that is programmed for the device to treat this delicate eyelid skin. You can't use the same handpiece that you use on the face to treat the upper eyelids. In addition, an intraocular eye shield has to be placed to protect the globe of the eye during treatment. So sometimes it may be hard to find a provider that has this specific handpiece and that is comfortable putting in an intraocular eye shield. But you'd only want to see an astute clinician or provider for this treatment. But the results are truly amazing. It's usually one treatment. Results last about 5 to 6 years, and there's no pain or no downtime time when it's done correctly. Next, let's talk about Botox for hooded eyes. So Botox for hooded eyes includes an injection right under the lateral brow to help lift up on the eye. Many people make the mistake of injecting Botox or a neuromodulator above the brow. This will only drop. You want to inject underneath the brow to open it up. And the mechanism of action and the way this works is because there's a muscle called the orbicularis oculi that goes around the eye. And when you soften it in this area, it allows the frontalis muscle, which is in the forehead, to lift up and to naturally open up the eye, which will help correct hooded eyes. Anywhere from 2.5 to 10 units can be used per side, and results last anywhere from 3 to 6 months. And with some of the longer lasting neuromodulators, it could last from 6 to 12 months as well. Thread lift for hooded eyes. So the way in which thread lifts work is that we place little PDO threads or thread lifts into the superior eyebrow area, and it helps lift, tighten, and pull on the forehead, which opens up the eyes. It's almost like a non-surgical brow lift or a non-surgical endo brow lift achieved with sutures, which is polylactic acid, which is what the PDO threads are made out of. It helps pull up on the frontalis or on the forehead skin that helps naturally open up the eyes. Typically, these results last anywhere from 1 to 2 years, but as with everything, it's very operator dependent. So make sure that you're going to an astute clinician who's very well versed and highly trained with thread lifts. So how do you know if you're an upper eyelid blepharoplasty candidate or a brow lift candidate? The way you know that is by where your eyebrow rests on your orbital rim, which is the bony part of the skull right above the eye. If your eyebrow rests on the bony part of the skull, which we call the orbital rim, and you have heaviness in your upper eyelids, you're more a blepharoplasty candidate. If your eyebrow rests below that orbital rim, then you're more of a brow lift candidate. And the way that we can achieve brow lift results without surgery is by using tightening devices in the forehead, not necessarily the eyelid skin, or by using PDO threads to help lift up on that excess skin, which is going to help open up the eye. How to lift hooded eyelids naturally. So a lot of you guys will ask how to lift your upper eyelids or to treat hooded eyes at home. And there's certain things that don't have a lot of scientific data backing them up, but have some anecdotal evidence that shows that it can be helpful. And those include face yoga for hooded eyes, gua sha for hooded eyes, and also at-home remedies like taping your eyes or using specific tape that can hold the eyes open. Gua sha and face yoga is very highly dependent on the individual person. Some people say that it really helps with hooded eyes and eyelid ptosis, but others will see no change at all. So I always say, try it yourself. It's an at-home remedy that's not going to hurt you, but don't be surprised if you don't get the results that you're looking for. The reason why gua sha or face yoga may not be helpful for hooded eyes is because eyelid ptosis, dermatochalasis, or hooded eyes just have to do with the eyelid skin in the upper eye. So no matter what you're doing to most of the muscles, or if you're mobilizing lymphatic drainage in the face, it is a very specific and very minute area in the face that needs to be affected. And with these methods, it's not always effective because you're not really targeting the upper eyelid skin. You're more affecting the mobilization of fluid around the area in the periorbital tissue, or you're affecting the muscles around the eye, but not that very specific muscle within the upper eyelid itself. A lot of patients ask about Upneek, which is an eye drop that you can take every day to help with eyelid ptosis. And I'm always conservative as a physician when putting something into the actual eye. And a lot of people do love this as a remedy for hooded eyes, but I myself don't usually prescribe it as a dermatologist because I refer to ophthalmology and to the eye specialist, because I always get worried about the side effects that you can have when putting an intraocular eye drop in to have some cosmetic change or aesthetic difference. I always am conservative as a provider and will refer to my ophthalmology colleagues because I don't feel that it's worth the side effects of intraocular eye irritation or redness or potential effects on your vision to get a cosmetic outcome. And the way Upneek works is it is an alpha adrenergic agonist, which helps contract the levator palpebral muscle, which is in the eyelid. But it's always important to remember you're not going to get a surgical result with non-surgical interventions. And it's always important to delineate the two. Also, to be risk averse and to have the risk of the treatment outweigh the benefit, I don't feel is worth it in my expert opinion. So next, let's talk about eye creams and how an eye cream can be used to treat hooded eyes. So eye creams are never going to give a surgical or procedural result, but they can do certain things like stimulate collagen and elastin, which can help tighten and smooth the periorbital tissue, whether that's the upper eyelids or the lower eyelids. There's different active ingredients in certain eye serums that are specifically engineered for that thin, delicate eyelid skin that can help, but it's always important to manage expectations and to know that the results that you get with a topical medical grade eye serum is not going to be equivocal to a surgical result or even a non-surgical in-office procedure. So what to look for in an eye cream? It's always important to look for active ingredients that are safe for the delicate eyelid skin that are going to upregulate synthesis of collagen and elastin, which are the extracellular matrix proteins that give eyelid skin that smooth, tight contour. The eyelid skin is different than skin on our face, and so it lacks a lot of the histological components that we have on their skin on our face, like sebaceous glands and other histologic differences that can sometimes make the eyelid skin more irritated or have less than desirable outcomes from the same products that we use on our face. So certain active ingredients to look for in eyelid serum or under eye serums include caffeine, green tea polyphenols, niacinamide, hyaluronic acid. These are safe and effective components in eye serums that will gently and effectively help diminish the appearance of under eye or upper eyelid wrinkles, fine lines, and loss of elasticity without being too irritating on the eyelid skin. So my skincare line, MDAiRE, which I formulated, contains an eye serum that has all the active ingredients that are specific for the eyelid skin, and also doesn't have any potentially irritating active ingredients that can do harm to the skin as well. Polyphenols and niacinamide, polypodium leukotomas, peptides, and DNA repair enzymes are really important and an effective way to help stimulate collagen without thinning the eyelid skin or causing irritation or post-inflammatory hyperpigmentation. When is surgery necessary? For each individual, that could be a really personal decision. And I actually have had an upper eyelid blepharoplasty. I had it when I was 41 years old, and I'm 46 now. And the way I knew I wanted surgery is I got to the point where I was having to lift up on my eyelid skin to wing my eyeliner and to put on my eyeshadow. And granted, I didn't have a lot of laxity or hoodedness on my upper eyelids, but I'm in the industry and have access to almost everything. So I went to Dr. Ray Taban, who's an amazing oculoplastic surgeon in LA and actually a good friend and colleague of mine, and had a great recovery, a great result. And I actually perform upper eyelid blepharoplasty myself for my patients in my office. So it was great for me to experience on the patient side of what an upper eyelid blepharoplasty entails. And I'm so glad that I did it. And I'm so glad I was on the other end of it. So as a surgeon, when I perform this procedure, I understand what my patients are going through. But it's a very easy, quick, an easy in-office procedure. It doesn't require general anesthesia. The scar is usually hidden in the crease of the upper eyelid, and there really isn't much downtime aside from 1 to 2 weeks of a little bit of swelling and bruising. And of course, you have to avoid heavy lifting and exercise, which is probably the hardest part, but definitely so glad that I did it. Let's talk a little bit more about surgery for hooded eyes or upper eyelid surgery, which we refer to as upper eyelid blepharoplasty. So what to expect when having surgery is it's usually done under local anesthetic, so it's not including an OR or general anesthesia. Usually localized numbing injection of lidocaine is used to help the procedure be very comfortable for the patient. And what we do is after you're numb, we take a little strip of the eyelid skin that is causing that laxity and we remove it and we sew that tissue together. And usually the recovery is about 1 to 2 weeks of some swelling, bruising, and avoidance of heavy lifting and activities. And what happens is 2 to 3 weeks later is you have your eyes bright and open and you feel more rejuvenated, and results last about 20 plus years. Many people will ask about the upper eyelid blepharoplasty scar. So the scar is usually hidden within the eyelid crease, so it's barely discernible. And usually in surgery, you have to follow certain rules as a surgeon, and usually the eyelid crease ends between the lateral canthus and the lateral brow. So the incision never goes beyond that point. Also, it doesn't go medial to the internal canthus and this is like getting too technical, it never goes medial to the punctum of the lash line. So it never is apparent because it's hidden within that eyelid crease and only gets better over time. So eyelid work is really interesting because it can dramatically change the way a person looks for the better. And it's usually just a subtle change. It could be something as simple as a brow lift with Botox or a quick laser resurfacing procedure of the eyelids, or it could be something a little bit more dramatic like an eye surgery. And surgery for hooded eyes includes a blepharoplasty, but another common eye procedure that a lot of the celebrities get is a canthopexy, which they can change the shape of the eye, and they can make the shape of the eye from a more round eye to a more almond-shaped eye, or almost like a fox eye or cat eye, which gives a more exotic, beautiful look. So a little goes a long way when it comes to eye procedures, and there's so many different procedures that you can do that can actually change the shape of the eye or rejuvenate the eye or open the eye. It just really comes down to a patient-by-patient basis and what you're looking for when you discuss this with your provider. As a dermatologic surgeon, eyelid surgery is actually one of the most rewarding procedures that I perform in my office because it can dramatically change the way a person looks once you correct the hooded eyes. There's some patients that will want a full face and neck lift because they feel tired because they have excess eyelid tissue. And when just doing a simple procedure that opens up the eyes, they feel so rejuvenated that they no longer need or want the treatments that they initially came in for. So just by removing a little bit of that excess eyelid skin with surgery or tightening it up with non-surgical interventions can have a big impact on rejuvenation of the entire face. Even for me specifically, I remember when I had my upper eyelid blepharoplasty, I had 2 kids under the age of 6. I was working 80 hours a week, and I always just really, really felt tired. And I had done a brow lift with Botox that helped, but I wanted a more impactful change that would be longer lasting and one that would not need maintenance. And so when I did have my upper eyelid blepharoplasty, I felt that it rejuvenated my entire face. I looked younger, I looked more awake, and I looked well rested even when I wasn't. And that was one of my favorite procedures that I've personally have had myself as a patient. Thank you guys for watching. We have a lot of fun videos coming up with before and afters coming your way, so be sure to subscribe. Also, for my subscribers to my channel, we also enter you to win a giveaway where you could win free MDAiRE products from my skincare line, but you have to be a subscriber to my channel. And also, because I'm non-sponsored, the only way to grow is organically. So if I find you and you find me, then it's meant to be.